Welcome to Little Steps, Big Gains. In the next two videos, we are going to discuss visual impairments in Parkinson's disease. Here in part one, we will discuss some of the most common types of visual deficits seen in Parkinson's disease with their functional applications. And then in part two, we will discuss skilled interventions for these impairments. If you find this video educational or helpful, please press that like button below. Check out my channel and subscribe for free educational videos and home exercise programs. In questionnaire studies, 78% of individuals with Parkinson's disease report at least one visual symptom, including things like difficulty reading, double vision, misjudging objects, or distances. It is for this reason that we're discussing visual impairments seen in Parkinson's disease. Now, due to time constraints, we don't have time to discuss all visual symptoms, but the ones we will discuss here include changes in contrast sensitivity, color vision, peripheral vision, motion and social perception, spatial orientation, oculomotor control, and double vision. First, contrast sensitivity. Contrast sensitivity is the ability to discriminate an object from its background. Studies show that individuals with Parkinson's disease struggle with this ability. For example, when provided with visual charts of letters of the same size, yet different levels of contrast, the individuals with Parkinson's disease struggled less with reading the letters, but had impairments in contrast detection. And this plays a huge role in our day-to-day activity, such as standing in the shower on white tile, stepping over a white shower threshold. Or how about putting on white toothpaste on a white toothbrush? Standing on the top of stairs, engaging the step length on our way down. Color vision. Color vision is the ability to perceive colors. Studies show that individuals with Parkinson's disease have abnormalities in this feature. For example, when tested to arrange colored discs into a smoothly color-graded sequence, the individuals with Parkinson's disease had a significantly higher error rate. And for this reason, some studies even suggest that this may be a non-motor clinical characteristic of Parkinson's disease when differentiating it from other diagnoses such as essential tremor. Peripheral vision. Peripheral vision is also called indirect vision, and it is the ability to discriminate details of objects outside of our center of gaze. When it comes time for Parkinson's disease, studies show a few unique findings. First, there's often greater difficulty in discriminating the details of these objects in the periphery. And second, when presented with multiple distracting images, there's often greater difficulty in ignoring the irrelevant ones. For example, in one study, individuals were given a visual task and then presented with multiple distracting images in the periphery. The irrelevant peripheral distractors interfered with the main task to a much greater degree. A few applications here is that it can make it so difficult to attend to a task in distracting environments, or also navigating around crowded environments. Motion perception. Motion perception is the ability to judge both the direction and speed of moving objects or bodies. Studies show that individuals with Parkinson's struggle both with object motion, with detecting direction as being more difficult than detecting speed, but also biological motion, detecting human movement. And this plays a huge role in driving, with detecting both the direction and speed of cars, and also, once again, navigating a moving world such as crowded environments. Social perception. We just talked about motion perception, but before we move on, let's touch on social perception. One definition of social perception is the ability to correctly interpret social cues to make accurate judgments about the feelings, characteristics, and intended actions of others. When it comes to social perception, individuals with Parkinson's disease often struggle with interpreting facial expressions. This is even more prominent with negative expressions such as anger, sadness, or fear. And therefore, it is so important that loved ones communicate with verbal versus nonverbal cues when expressing their feelings with their loved ones. Spatial orientation. Spatial orientation is the ability to detect both the position and direction of an object in space. When it comes time for Parkinson's disease, studies show a few unique findings. First, studies show impaired spatial awareness and low spatial acuity, knowing where things are in space. And this contributes to difficulty judging objects and distances. Second, some studies have found evidence of spatial neglect. Spatial neglect is the inability to observe and or orient to information on one side of the body. It has been found that individuals with left-sided impairments may have a right-sided bias. In other words, difficulty perceiving their left visual world. This has been seen through line bisection tests, where individuals were given horizontal lines and instructed to mark the center of the line. The individuals with left-sided but not right-sided impairments had abnormalities on this test. And this is so important because it may make it difficult to navigate around obstacles in the left visual world. And third, for these individuals, alongside that right-sided bias, objects in the left visual field actually appeared smaller than on the right. And this can really skew our visual representation of things like doorways, contributing to freezing. Oculomotor control. Oculomotor control refers to the coordination of the muscles around the eyes, and it plays a huge role in obtaining accurate information about the visual world. Three of the most important movements we have include smooth pursuits, which is tracking moving objects, saccades. This is jumping back and forth between targets, and convergence, the ability to bring the eyes close together to focus on nearby targets. Just as Parkinson's disease affects the coordination of the limbs, it also affects the coordination of the eyes. Starting with smooth pursuits. When testing the ability to smoothly track moving objects with individuals with Parkinson's, we often see a few things. First off, there's often a delay in the initiation of the movement. Second, we often see sort of glitches, episodes where we lose focus along the way. This is important and plays a huge role in things like driving, motor planning, and responding to moving objects. A second important movement is called saccades. This is the ability of the eyes to jump back and forth between targets. When it comes time for Parkinson's disease, we often see a few things. First off, often there's a reduction in amplitude. The eyes are not jumping far enough to get onto the target. This is also called hypometric movements and actually plays a huge role in turning. One study below showed that saccadic eye movements contributes to freezing in Parkinson's during turning performance. A second thing we often see is a reduction in accuracy in remembering those targets. This plays a huge role in reading and may increase reading time. A third important movement is called convergence. This is the ability of the eyes to coordinate together, move together to focus on a nearby target. Unfortunately, Parkinson's disease can impair the coordination of this movement. This is called convergence insufficiency. Some common symptoms of convergence insufficiency include eye strain, blurry vision, headaches, short attention span, constantly adjusting the distance of objects like a book, or losing your place on a page in a book. This also plays a huge role in depth perception, such as when facing a step, predicting the height and the footfall placement on that step. Double vision. Double vision is seen in up to 30% of individuals with Parkinson's disease. It's often due to a convergence insufficiency or a slight misalignment of the eyes. However, people don't often report this symptom unless they're asked because it comes and goes. So as we have learned, Parkinson's disease can cause many changes to the visual system. Some of these include changes in contrast sensitivity, color vision, peripheral vision, motion and social perception, spatial orientation, oculomotor control, and double vision. Next, we will discuss skilled interventions to address these changes. and a link to that video will be in the description below. If you have Parkinson's disease, I hope you found this video insightful or validating in understanding your experience and sharing that with others. If you're a fellow clinician or a loved one, I hope that you found this video educational and valuable in expanding your understanding of Parkinson's disease. And if so, please press that like button below. Subscribe and check out my channel for free educational videos and free home exercise programs, because little steps together we can make some big gains.